good arms over the years, but Frank here has a really good arm. So does Carla. Louisa's got a great arm. Marcus too. Everyone in our region has a great arm, capable of defeating COVID-19. So get your vaccination when you can. They're safe and effective. It's been a challenging year with times of anxiety and loneliness. Together, we can make this the greatest comeback win in Philadelphia history. We'll beat COVID-19.
Hello, everyone. I'm Charlotte Sutton with the Philadelphia Inquirer, and I have a very special guest today on Inquirer Live. Dr. Lisa Walke is the chief of the Division of Geriatric Medicine at Penn Medicine. Before she joined Penn in July of 2018, Dr. Walke served as the associate chief in charge of clinical affairs at Yale Medical School. Her career in geriatrics, though, developed during her internal medicine residency at Montefiore Medical Center in New York. At Penn, her focus is on strengthening collaborations between the numerous entities at Penn that are involved in areas related to aging, including, but not limited to, the Institute on Aging, the Penn Memory Center, Penn Nursing, and many more. Her personal scholarship area is in the care of older surgical patients and improving outcomes for that group who, of course, face special challenges going through surgery. So welcome, Dr. Walke. It's so good to have you here with us.
Thank you. I appreciate the invitation.
Absolutely. I have a ton of questions, and our readers and viewers have also submitted a ton of questions. So let's get right to it. I thought we could start out by talking a little bit about your medical specialty. Sometimes people are not totally familiar with what geriatric medicine is, and also more specifically, at what point might a person or a loved one benefit from seeing a specialist such as yourself?
Okay. That is really a good place to start because, as you said, not everyone's familiar with the geriatrician or geriatric medicine professionals. I think one of the best descriptions I heard recently was from one of my patients who said that geriatricians are specialists in whole person care. And I would just add for older adults. And so I'll just break that down a little bit more. In terms of being specialists, we do geriatric medicine after having done our residency in internal medicine or family medicine. So it's subspecialty training similar to cardiology or GI, pulmonary. It's after we have that foundation in either internal medicine or family medicine. Mm-hmm. And then in terms of thinking of a whole person care. So with geriatrics, our focus is what the values of our patients and what matters to them. And so recently we have coined the kind of 4 M's, and that focuses on what matters most to patients and then trying to focus on their mentation, mobility, and avoiding medications that might negatively impact any of those things. So once you know someone's values and what is important to them, that's how we then work as a team to come up with the plan of care. The other part of whole person care is that we recognize for many older adults, it's not just them. They have a care partner or a loved one, some support system that they would like to have included in their medical decision making, or that they rely on when they're making decisions just in general about their health. So we recognize that it's not just the patient, it's the caregiver or the care partner with the patient, and we, with the patient's permission, if they wish, involve them in the care planning as well. And then the part for older adults, so this is always the question, right? What age do you become older? When does it become an older adult? For purposes of insurance, most people think of an older adult around age 65 because of Medicare. But truly, with us in geriatrics, what we learned during our fellowship are the normal physiological changes, like normal aging. What can we expect, all of us, as we get older? And then what are common conditions or diagnoses that happen in older adults but aren't necessarily part of normal aging? So having that as our additional set of information is where we add that into the values and such of how we're making recommendations and how we work in partnership with our patients. So most of the people that we see are probably in their 70s, 80s, or 90s. There are times, though, that there are people who might have a geriatric syndrome or a condition that is impacting their cognition or function earlier in their 50s or 60s, and that would be a person we would see as well.
Okay, I see. And it's interesting, our excellent aging reporter, Stacy Burling, recently wrote a story in which you were featured, where you were talking about telemedicine and how it obviously has become a lot more popular during the pandemic, but it's been a good tool to bring families into the healthcare of their elder loved ones.
Absolutely, particularly as was mentioned in that story, long distance caregivers, individuals who before had to fly in, but even if you're local, depending on the timing of a telehealth visit, that caregiver may be able to do it on a lunch break, right? Or do it while they're at work instead of having to take the whole day off, let's say. And so in that regard, it's been beneficial for many families to be able to have their care partner, adult children, whomever, engaged in the visit in real time, right? They don't have to give the summary after of what was discussed. They were there. They can ask their own questions. They're part of the process. They can help with the planning of when things need to be done, or testing, or picking up medications, all those kinds of things. So it allows for another set of ears. It allows for some additional opinions. And sometimes, depending on what the issue is, you may not be able to take all the information in. And that's when it's really good to have someone else who may hear things that you haven't quite heard just because you're thinking about something else.
Right. So speaking of the pandemic, how are your patients accepting the vaccine? Are most of them enthusiastic about it, or are some still pretty reticent?
I would say the majority of my patients are pretty much fulfilling the statistic that that was shown in the video before we started, that the majority of people have already been vaccinated, if not completely, certainly by one vaccine. There are some people who are hesitant, but it's not just about COVID, right? They might be hesitant about flu or just anything in general. And so they're still trying to kind of wait and see or make a decision. But the vast majority of it's rare when someone hasn't had a vaccine yet when I speak with them, because I ask all of my patients if they've been vaccinated yet.
Right. And here's a question that one of our viewers asked that I thought was an interesting one. What are the best ways, if you're talking to someone who isn't quite on board, shall we say, with evidence-based medicine, what are the best ways that you found to try to approach that kind of reluctance or even denial?
So the approach that has worked well for me is one, not considering it kind of a zero-sum game, so to speak. I win, you lose, someone has to kind of give up, so to speak, but having it as more of a conversation and a discussion. What's the reason why someone is maybe hesitant or hasn't received the vaccine yet? And so if it's based on misinformation or lack of information, then you can share that, right? You can both go to a site that you can rely on, you can trust, CDC or other sites, and look up information and be able to share. If it's just that they are a late adopter, not everyone picks things up right away and they wanted to wait and see. Well, we're about 6 months into it now, right? So maybe it's been enough time to wait, and you can encourage them. But I think when we make it a kind of I'm trying to force you or trying to get you to do something that you're really hesitant about without understanding where the hesitation is coming from, that tends not to work well. So even patients of mine who initially said they didn't want to get it, or other people I've come in contact with who said no, with a little bit of time, or they saw I got it, I was totally fine, I had no problems. They felt me more reassured. And some people have since gotten the vaccine who initially told me absolutely no way that they would get it. So I think a little patience goes a long way as well.
Well, you say that for most things in life, I imagine. So obviously you have a patient population, many of whom might have underlying conditions, some of which would affect immunity. What do you tell your patients who have had the vaccine but have some underlying issues that may affect their immune response? How are you advising them to kind of reintroduce themselves to the world?
Yeah, so a really important question. And just to remind everyone that the recommendations that are coming out in terms of precautions that one should be taking still, or maybe no longer need to follow, are for individuals who have been fully vaccinated, meaning that they've received either both doses of the Pfizer or Moderna, or the one dose of the J&J, and they're 2 weeks out from when they received that final dose. There are still some things we are in the process of finding out. There's still some things we're learning about the vaccines. And one of those things is how individuals who have immunosuppressed systems, or who maybe are a little bit more immunocompromised, how are they responding to the vaccine? Are they getting the full response? So that's really an individual decision as we're still gathering this information. For patients that I have who perhaps you're on medications that suppress your immune system, either because of a transplant, let's say, and so you have to be on chronic immunosuppressant medications, or you have a different condition that we treat with immunosuppressants. Those are individuals that I'm still recommending that they be cautious, meaning that if they are in mixed company, perhaps where they might not know who else is around, or a crowd and it's indoors, they might want to consider, do they still want to wear a mask and or social distance, until we have a little bit more information. But it depends on the individual. And certainly if you have a condition and your immune system is suppressed, and intentionally or otherwise, you might just want to consider being a little bit slower with taking off the mask, with not doing social distancing outside of your household. But certainly not saying that you couldn't do it at all, just want to be a little bit more cautious.
Are there tests that you can give people to see what their immune reaction is like?
So good question. One of the things I think that's being worked on, of trying to see how robust someone's antibody response, let's say, is to the vaccine. Certainly studies are being done, but I don't know of anything on a commercial basis right now that you can go and either test yourself at home or go get a test to say you have an antibody response of this level or next. It's certainly something that I'm sure people are working on, but we don't have quite yet. And quite frankly, if we remember, the vaccines have only been out for less than 6 months. So it's still us gathering some key information.
Right. I have a question here from a viewer asking, do you have any sense as to when we will see booster shots?
Oh, Good question. I don't have any definitive answer or response for that. You would imagine, given that it's a disease that transmits respiratory wise a lot, that it would likely be something similar to what we do with the flu shot. So around the time of the year when we're going to be more indoors and or closer together and therefore more likely to be in an enclosed area, that might be when we need to do the boosters. But it's also going to largely depend on the science, and if we get a better sense of how long your immunity lasts after you get the vaccine. That's really what's going to drive it, and that's work that's ongoing. So if we learn, for example, that immunity wanes over the year, similar as it does for flu, and or that there are multiple variants that come out, then we'll likely need a booster around the time that we know there'll be a peak. But if it is that our immunity does last long enough, we might not need it, twice a year. It might only be once a year or every couple of years. So that's a kind of stay tuned, something that'll certainly come out sometime in the near future.
Great. Yes, I had another question here from a reader saying that they've got chronic conditions and wondering, should they insist that people who come into their home, whether they're health aides or visitors or whatever, should they continue to insist that they wear masks even if they are vaccinated?
Even if the person coming in is vaccinated or the person whose home it is vaccinated?
Well, we probably ought to look at all the possibilities here. If the person with the chronic condition is vaccinated and getting a visit from someone who is vaccinated, do you think that they need to insist on everyone wearing masks?
Okay. So we are still learning whether or not someone who's been fully vaccinated, i.e. the person coming in, can transmit the virus that causes COVID-19 to someone else if they're asymptomatic. So you might be positive and not know it because you've been vaccinated appropriately and therefore are not expressing symptoms. But we don't know yet if you can transmit that to someone else. Now, in theory, the person whose home they're going into has also been vaccinated. So it would lower their likelihood of being able to catch the virus if that person were shedding it, if they were contagious. However, again, with their chronic conditions, so I'm not sure if the chronic conditions are ones that suppress your immune system or are more like hypertension, arthritis. If it's not something that's suppressing your immune system, then they should be fine because they would have a response that would be protective. If they have conditions that have suppressed their immune system and the other person is coming in, it's still their prerogative to ask, could they wear a mask or such if they felt uncomfortable. But we don't have any evidence to say that that's necessary at this point.
I see. Okay, that makes sense. Let's shift over to the kind of excitement and challenge, shall we say, of re-entering society. I saw some very interesting polling that people who have been in lockdown, a lot of them have developed certain health issues, shall we say. And so I thought maybe we could just go through them and you could perhaps give your recommendations, for people if they find themselves in this situation. Sure. What's a good way to respond? The first one here, over 60% of adults reported undesired weight changes. And I'm going to guess that for most people, it was gaining weight. So if you've got someone, especially an older person, who has put on some pounds, what's your first recommendation for them?
So the first recommendation is you gained it, you can lose it. So give yourself some grace. You can certainly lose it. And to be active. Exercise is great for so many things, including weight loss and helping to control chronic conditions. And we're also entering, the time of year where it's nice weather outside. So start with going for a walk. And if you can only do 5 or 10 minutes at first, that's fine. Build up to, 20 minutes or 30 minutes at a time. So it doesn't have to be 0 to 100, right? You have some time that you can build up in terms of your endurance and being more active. People like to garden. You can start back with gardening. Remember whatever hobbies or things you liked to do before that perhaps you put on hold for the past year, and start slowly going back to those activities, to start doing those things again. So that would be one. The second thing I would say is being mindful of your eating. A lot of us did comfort eating, so to speak, over the last year plus with COVID. It's kind of like initially we didn't know how long it was going to last, so every meal was a comfort food meal every time we ate, and then it lagged on, and it was months, and then it was years, and sometimes we're still eating to comfort ourselves. So realizing that we're starting to come out of the pandemic, while it's not over, we're definitely starting to see some light at that end of the tunnel. And so just being mindful, are you still doing emotional eating? And if so, it starts to try to cut back on that.
Okay. Now, I know there are a lot of people who think that, if they've put on some weight or they aren't so active or whatever, that their doctor is going to yell at them. As a medical professional, how do you really feel when one of your patients comes in and says, "Oh my God, Dr. Walke, I'm sorry. I've just been sitting on my butt and just eating chocolate for a year. I'm so ashamed of myself." Are you horrified?
No, not at all. The first thing is recognition, right? Understanding how you got here, and they're explaining that to me. But again, every day is a new opportunity. And so there's an opportunity to be more active. And that's what I advise my patients. Start off with being more active. I think a lot of us think of exercise as I have to, put on my gym clothes and I have to head to the gym or run around the block or swim several laps. And that is what you have in your mind of exercise. And that's great if you're there and that's what you're doing. But if you're just getting back on track, start with being active. And to me, that can be small things, as I mentioned to people. Instead of driving and into your home, and if your mailbox is at the end of your driveway and you stop the car, you pick up the mail, you drive into your garage and walk back and get your mail. If you're going to the store, going someplace, don't drive around 3 times for the closest spot. Maybe take one a little bit further away. So you add an activity into your normal day-to-days. And as you start doing that more regularly, then you might get to the level that you want to do exercise or a more formal time. But we can all just be a little bit more active than we are. So start there.
Okay. Now, do you recommend that people do specific things to improve balance? Because obviously falling is a real fear as we get older. What sort of recommendations do you make to prevent falling?
Yes, so you're absolutely correct. Doing balance exercises are really important. We know that unintentional falls is one of the leading causes of morbidity. One of the leading reasons why older adults wind up going to the emergency department for medical care. So as best as possible, we want to try to decrease someone's likelihood of falling. So exercises that increase or help with lower extremity strength help you with balance. And so if you're a person that likes weight training, those types of things, lower extremity, things that deal with balance, like Tai Chi, that helps with balance and your sense of where you are in space. That's been shown in several studies, Tai Chi, to decrease risk of falling. So things that will have you practicing your balance. Also, the National Institute on Aging, if someone wants to, they have a booklet on their website. It's free. You can just have it mailed to you, and it has different exercises for older adults that you can do with limited equipment or that you can do at home. And so some of them focus on balance, some focus on endurance, some focus on strength. So you really can get various different levels of activity looking at that book, and I believe it might be online as well. So it's not a one size fit all. There are different things that you can do, but definitely focusing on balance is very important.
Okay, great. Another thing that Americans are having trouble with since the pandemic, 67%, they are sleeping more or less than they would really like to be. What are you seeing in your patients in terms of sleep issues?
So it depends. I agree. I've seen some of both sides. I've seen initially some people were sleeping less because there was a little bit more anxiety and uncertainty. And now maybe it's swung and some people are sleeping a little bit more. The recommended amount of sleep, which is, just a recommendation, it varies per person, typically about 7 to 9 hours a night. That said, as we get older, we tend not to sleep for quite as long. And so it's not uncommon for an older adult to say they sleep 5-6 hours and feel well rested when they get up. The key is feeling well rested when you get up. So if you are sleeping 10 hours and you get up and you're still exhausted, there's something that's concerning. And so you might want to consider, is there something else going on, i.e. problems with your mood, feeling a little bit more sad, a little bit more depressed. We know that when our mood isn't great, people tend to either not sleep well or sleep too long. So if you're noticing other things besides the sleep being off, that might be a time that you want to reach out to your healthcare professional and just mention to them that you're having some challenges with sleep. Let them be able to assess and see if there are other areas that you're also having challenges with. And it might be not just a sleep issue, but a larger issue, and they can help with that.
Good point. Drinking is more of an issue now for people than it was before the pandemic. And my understanding is that especially for older women, drinking too much alcohol is a more common thing. Is that also a phenomenon that you're seeing in your patients?
Not as much, although, again, at the beginning of the pandemic, quite a few people mentioned bottles of wine here or there, but I haven't heard that quite so much. That said, for older adults, regardless of gender, the recommended amount of alcohol is no more than 1 drink a day. That being that there are changes that happen with normal aging, our bladder size shrinks, amongst other things, that our body is less able to tolerate perhaps the same amount of alcohol that you took at a younger age. So, for example, younger adults, the recommended amount for men is no more than 2 glasses a day, but that goes down to 1. And it's always 1 for a woman. So if you're drinking more than that, or cumulatively over the weekend, so maybe you're not drinking at all during the week, but then on the weekend you're binge drinking, that again is problematic. So definitely want to drink in moderation if you choose to drink alcohol. And again, the first step is really recognition. So if you're noticing that your bottle of wine is going by quicker than it used to before, just being more mindful. Don't pour mindlessly. Take account of what you're drinking and again, try to decrease it.
Okay, great. And a lot of people are saying, this is nearly half of Americans are saying that they delayed or canceled healthcare services since the pandemic started. Are you having a hard time getting people to come in for their screenings and their checkups and all that?
To some extent, yes. And you're so right. That appropriately so in some cases, and in other cases, it was just the uncertainty. Even though Penn Medicine, we were open all the time, for some places, people weren't sure if their practitioner was there, if they could get certain tests. But certainly we've been all open for, a while. And some people have gotten off schedule, right? Your screening tests, your normal routine tests that you may not have an issue that you're trying to address, but just trying to stay on top of your health. A lot of people had those things kind of fall to the wayside during the height of the pandemic. So certainly this is a time to reassess. Are you up to date with your medical appointments, your dental appointments, your eye doctor appointments? Most of these things are at least annual, if not biannual. So if you haven't had it done recently, this is a good time to call and schedule those appointments so you can get back on track. Don't wait until there's an issue or a problem, because we know oftentimes then things may be more advanced than if we do the screening, if we do things on a routine basis. So this is a good time for people to do that assessment. The past year went by quickly, so It may seem like you just had something done, and it very well could be well over a year. So, time to call, schedule some of those appointments, pace yourself in doing them, but definitely get back on track with your health.
Okay. And what about overall mental health issues? Are people, are you seeing people with more anxiety, depression, those kinds of things?
Yes, absolutely. And it's been for different reasons over the course of the past, year plus. So initially it was the uncertainty and not knowing what was going to happen with COVID, the fear, would the individual get COVID with their family members? And then over time, now it's shifted almost to the reverse of fear of reentry, right? A fear of getting back into doing things. Is it safe to go back and do things? Haven't been connected in the same way for such a long time. And so yes, definitely still seeing some of the mood components, but now for an opposite reason. And the approach is slightly different, but both sides need to be addressed. So certainly if you're feeling more anxiety or uncertainty because now you're not sure how things are going to be moving forward, that's understandable. But we want individuals to be at a point where you might have some concerns, but still function. That's when you know something, when you have a mental health issue that needs to certainly be addressed. If your ability to function, if your ability to do your day-to-day activities, your ability to enjoy the things you normally enjoy, if that's being impacted, you certainly need to reach out to a healthcare professional.
And we've heard a lot about the really difficult time that people with dementia have been having in terms of declining. What are you seeing there?
So, being social, having cognitive stimulation is important for everyone. Certainly important as you get older, and is essentially critical for individuals who have dementia or have cognitive impairment. So, not being able to engage in the same way with conversations, engage with activities, people have noticed more difficulty with their thinking and with their memory, feeling not quite as sharp as they even were before, even though they might have had some level of impairment, still not quite as able to process in the way that they were doing before. We really don't know if people will get back to where they were fully, but what I recommend for my patients is to resume some of those social and cognitive activities, whether it was, playing cards with friends or doing other crosswords or word searches or just going to social groups, special events, anything that without recognizing it, those things all keep you oriented in terms of date, what's going on. They give you something to look forward to, and they lay down new memories as you're having these discussions and interacting with people. So I'm encouraging all my patients to, as best as you can, try to regain those connections, regain those interactions as a way of helping our brains and helping our memory become, more sharp again, more clear, so that they feel they're more on top of things.
And do those interactions really have to be in person, or is it okay if you're still doing FaceTime, or is that less useful?
It's definitely okay if you're doing it virtually, FaceTime or another means. And so I think you might find it more enjoyable if you want to be in person, if you want to reach out. But in terms of effectiveness, doing it virtually seems to be effective as well. So it's definitely better doing it virtually than not doing it at all. So if you're not quite sure, or you're not sure if the person is someone that you want to come in, or maybe they can't, maybe they're a distance, then definitely doing it virtually. And that's one of the things I'd recommend to people in general as we're emerging from the pandemic, is to retain the positives that we gained during this time. Right. So if you learned how to do video visits and you became somewhat proficient, there's no need that you have to drop that. You might still have family or friends that are distant, and instead of not connecting with them at all, you now know how to do it with video visits.
Right.
If you picked up a new hobby, bread making or whatever during the pandemic.
Tai Chi.
Right? Any of those things you picked up, you don't have to stop it just because we're reemerging. So hold on to the positives. And I think for most of us, even if it's the positive was appreciating the small stuff, right? Most of us learned to appreciate just very small things when we didn't have them anymore. Let's take that with us as we're emerging out of the pandemic, right? Continue to hold on to the positives that we got during this time.
Okay, definitely. I've had a few questions here from people who are, it sounds like, dealing for the first time maybe with family members and loved ones who are having cognitive issues. And one reader asks, where do you begin when you think that a family member might have dementia? What's the first thing you do?
Really good question. So the first thing you can do is reach out to your healthcare professional and let them know, the person's healthcare professional, not necessarily yours, but if it's a loved one, reaching out to their healthcare professional and saying that you've noticed a couple of things. You have some concerns, and can you discuss it? Can the person come in? Can they get maybe initial assessment? If your healthcare professional is not versed in doing cognitive assessments, or they themselves don't do it, they can certainly refer you to a geriatrician or a neurologist or geriatric psychiatrist, someone who does cognitive assessment routinely, and then you can get a more formal assessment if your initial practitioner seemed to think, well, yeah, there might be something here that we need to evaluate a little bit further. So that would be the kind of first thing. And what that session would be like with a cognitive specialist, whether it's a geriatrician or neurologist or a geriatric psych, they will ask questions about what you've been seeing, or what were the concerns that led to that appointment, but then also will ask some cognitive memory questions of the individual and some judgment questions and different scenarios, and will basically do some testing, cognitive testing of various parts of the brain and thinking, and that will give a better sense if there seems to be something beyond what we would expect, like the norm to be, and if there's something else that we need to do moving forward.
Okay. And then I have a question here from someone who I think is already dealing with a loved one in this situation, asking, what's a way that a caregiver can respond kindly when their loved one is constantly repeating the same thing and it's driving you crazy?
No, really great question. And the kindness part is key to that as well. Part of what I do and I discuss with caregivers is remembering the person clearly they're not doing it on purpose, right? They truly are not recalling, and that's why they mention it again. And as best as possible, if you can answer again calmly and without it, being challenging for you. But if it's starting to wear on you a little bit, I've answered this now 3 or 4 times. You can try changing the topic, right? Change to something else. Maybe if they're asking, where are we going today? And you've answered that 5 times, then maybe say, oh, well, let's have a conversation about this, or let's go watch a show, or whatever. Just kind of change the topic and set a new tone. But certainly getting frustrated or saying things like, I told you that already, or you've asked me that 5 times doesn't help. And if anything, it gets the person a little bit more riled up because they can feel that emotion from you, right? They know that it's unacceptable, and then they might react to that emotion rather than before, where it was just a repetition of a question. But that's really one of the hardest things for caregivers of someone with dementia, is that repetition, and how do you answer multiple times without it getting to be a little bit wearing. But remember, each time it's the first time for that person.
Yeah. And the other thing too, I think it's difficult when you're talking to someone in your family, let's say a parent or a grandparent, conversation might naturally turn to, do you remember when this happened? But that could be a really unkind question for someone with dementia, couldn't it?
Yes, unintentionally so, but yes, and because if they don't remember, depending, so the classic with Alzheimer's dementia, at least, is that your long-term memories are oftentimes retained. It's your short-term memories. So if you're going down a trip down memory lane, and do you remember the time, mom did this or granddad did that or whatever, they might be able to continue that conversation and actually truly recall and give you the details. However, if you say, do you remember what you had for breakfast this morning? They may not be able to do that. And so depending on what you're talking about, it's not necessarily all or nothing. It's not like they recall nothing. There might be some memories that they do recall. And so engage them in those conversations.
Mm-hmm. Absolutely. I think one of the things we saw very early in the pandemic was a great deal of concern from people who had loved ones in assisted living or in other kinds of senior facilities, that they felt they were terribly isolated. And I heard a lot of people saying, well, that's it. I'm going to stay at home, or I'm going to keep my mother at home with me. If you're in that position, what kind of advice would you have for families that are deciding, we're going to have a multi-generational household here because we don't want to run that risk of one of us being isolated that way?
So the first thing I say to people is whichever choice they make that's right for them is the correct choice, right? It's not, this is a right and that's a wrong. So if you as a family decide that you want to have your loved one at home, then that's the right choice for you. And what your healthcare team, particularly a geriatrician or other specialists, will do is to help you keep that person at home safely and to put resources in place if need be to help with that. Mm-hmm. But realizing that depending on the amount of hands-on care that person may need, can sometimes be more work than people recognize to have a loved one at home. So it may not be easy street, so to speak, but if it's something you're committed to and you're interested in doing, then certainly your healthcare team can help make that happen. By the same time, if going into an assisted living or a long-term care facility is what works better for the patient and the family, then that's an okay decision as well. It's not to say that is something that has to be avoided, but I understand the concern you mentioned. I mean, I think that, as a chief of geriatrics, and we provide care in a couple of long-term care facilities, I know the amount of dedication that the physicians and nurses and nurse practitioners have to residents in these long-term care facilities. You get to know them over months to years. And so while it's not the same as family, certainly in terms of being able to come in or see them, staff really do become close to the residents and see them as a second family. And certainly during the height of the pandemic, when loved ones, caregivers may not have been able to come in, the staff went above and beyond to really make sure people weren't isolated and they weren't by themselves, because they knew even more so they were their contacts, they were their social contacts for the day. And so I think that if you have a loved one who's in a facility, you don't have to feel that they're completely isolated. You may not be able to see them in the way you want if there are still restrictions, but certainly know that most institutions have staff that are really engaged and care quite a bit for their residents, and so have that to be a reassurance.
Okay, good. I wanted to ask you one of the obviously a big hot topic for a lot of our readers, probably at the younger. Well, no, I should say at all levels of life. I mean, whether they're in their 20s, their 60s, their 80s, everybody wants to know about anti-aging and how do I stay young, either my appearance or my physical abilities. What do you think? What do you tell your patients who come to you and they're frustrated over their limitations? What's your best advice for them?
Well, so this isn't new, right? This goes back to Ponce de Leon and looking for the fountain of youth back in Florida. So this has been a centuries old thing. I say to do as best you can the things we know that help. But genes do play a part. So it's not that you can necessarily reverse everything, but as best you can, you want to get an appropriate amount of sleep. You want to get exercise. You want to try to eat healthy, meaning well-balanced meals. You want to avoid tobacco products, cigarette smoking, things that ages your skin. So particularly if you're trying to avoid the appearance of aging, you want to avoid those things. Getting a proper amount of sun exposure, right? Not too much, because that'll also age in your skin as well in terms of appearance. So basically, do as best you can the things that will help. Drinking appropriate amounts of water, getting the exercise, being active, and doing your part as best you can. That said, doesn't mean that you'll do that and look like you're 20 when you're 60, but at least you've done what you can do to try to stay as youthful. And also, part of youth is your mentality, like your approach, right? Your joie de vivre goes a long way. So remember that as well. It's not just external; it's how you view life and how you approach life that also makes you youthful.
Do you have patients from your career that you look back on and think, wow, that person is such an inspiration with what they do and their attitude? Can you tell us anything about people that you found particularly striking?
Yes, I mean that's quite frankly one of the main reasons why I went into geriatric medicine, because there are just so many inspirational people who either share their life lessons or just what they're still doing at 85, 87, 89 is just inspiring. And so for some people, it's being active and going out and being engaged in 5K walks and things like that on a regular basis, or raising funds for charity through those kind of fundraising campaigns. But there are also people who are still volunteering, not with COVID, but prior to that, we're volunteering in schools. I know someone who, before the pandemic, was volunteering as a teacher's aide in public schools, and she's 92. And so you don't have to think, well, I can't do that, or it's beyond my time. I think the people I've been most impressed with are those who have used their talents, or maybe even a new skill set, something they hadn't done. It wasn't their life's profession. This particular person wasn't a teacher. It was just something she thought was important. So that's been impressive to me. People who have continued to live their life to their fullest, regardless of what their age may be.
Yeah. Well, and with kids going back to school now after a very difficult year, I'm sure that the need for experienced tutors in all kinds of areas would be really huge.
Yes, absolutely. And in new areas, new ways, right? If you have life experience, you can probably help a grade school child with some of the things they have going on. So just being creative, thinking of how you can give back in different ways.
Right, good. So I feel like we've covered a lot of territory here, Dr. Walke. Is there anything that you would like our viewers to know about what you do, or the research that you're doing now? That's something we can look forward to talking about maybe in the future?
That's interesting. Thank you for the opportunity. I mean, what as I think was mentioned in the intro, my particular area of scholarship is I work on developing innovative models of care for older adults, in particular older surgical patients. And so I'm presently working with some colleagues to develop a co-management program for older surgical patients at HUP, at one of our hospitals, and also at Pennsylvania Hospital. So hopefully in the next couple of months, I could perhaps come back and tell you a little bit more about both of those services. But we know that surgical patients who have care from a combined team that includes geriatricians as well as surgeons have been shown to have better outcomes.
Interesting.
Working on development medicine. We already have a program at Presby, so at Presbyterian we already have it. So I want to expand it some more, just to clarify.
Yeah, it's been so fascinating to see patients with long haul COVID symptoms, and in many cases, some of them seem to be having some of the same kind of issues that people who were in ICUs for completely unrelated reasons.
Yes.
So that seems like a very rich area for research in the years to come.
Absolutely, and particularly how long will be the duration for long haulers. They're not all the same either. Some people have been longer than we expected, but not. I mean, I saw people in April who had COVID the April before and was still having symptoms. So a full year later, and some people, just had symptoms lasting for a couple of months. So what's the difference between someone that was a long hauler for months versus a long hauler for a year or more? That's certainly an area that will be an area that people are starting to look at and will continue to look at as we gather more information about the virus and the pandemic.
Absolutely. Okay, well, thank you so much. This has just been fascinating. I've really enjoyed talking to you, Dr. Walke. I really appreciate your time, and come back anytime and tell us what's happening next. It sounds like a really exciting area that you're building over there at Penn.
Well, thank you so much. I really appreciate the invitation and the wonderful questions that you had. And yes, I will look forward to coming back sometime in the future.
Great. Thank you so much. And thank you too to our audience. I'd like to point out quickly before we go that if you want to talk about medicine at the other end of the age spectrum, on Tuesday at 1:00, my colleague Kelly O'Shea will be speaking with an expert from St. Christopher's Hospital for Children about all things related to the vaccines in children. As we know, they are rapidly being approved for younger and younger people. You can catch that program Tuesday, June 1st at 1:00 on our Instagram, which is at Philly Inquirer. And so I hope to see you all there. And again, thank you to Dr. Walke, and thank you to our sponsor, Independence Blue Cross, and thank you to all my colleagues at the Philadelphia Inquirer for making this happen. Thank you all and have a great evening.